the bill.
Senator Sanders.
Let us be clear, Joe. In the United States of America, we are spending twice as much per capita on health care as the Canadians or any other major country on earth.
This is America.
Yeah, but Americans don't want to pay twice as much as other countries. And they guarantee health care to all people. Under my Medicare for All proposal, when you don't pay out of pocket and you don't pay premiums, maybe you have run into people who love their premiums. I haven't. What people want is cost-effective health care. Medicare for All will save the average American substantial sums of money on his or her health care bill.
Senator Klobuchar, you said in your opening statement you want to represent the people stuck in the middle of the extremes. Who represents the extreme on this stage?
I think you know that I don't agree with some of these proposals up here, George. So I'm talking
Which
about
ones?
if I could respond to some of the proposals from my friends. First of all, Senator Sanders and I have worked valiantly to bring down the cost of pharmaceuticals. That was a Klobuchar-Sanders amendment to allow for drugs to come in from less expensive countries like Canada. We have worked to bring down the cost by fighting to allow 43 million seniors, that's a bill I lead, to negotiate for better prices under Medicare. I figure that's a lot of seniors and they should be allowed to get a better price. But when it comes to our health care and when it comes to our premiums, I go with the doctor's creed, which is do no harm. And while Bernie wrote the bill, I read the bill. And on page 8 of the bill, it says that we will no longer have private insurance as we know it. And that means that 149 million Americans will no longer be able to have their current insurance. That's in 4 years. I don't think that's a bold idea. I think it's a bad idea. And what I favor is something that what Barack Obama wanted to do from the very beginning, and that is a public option, a nonprofit choice that will bring down the cost of insurance, cover 12 million more people, and bring down the prices for 13 million more people. That is a bold idea.
Senator Warren. Page 8 of the bill, she says, 149 people will lose their health insurance.
I'm sorry.
She said page 8 of the bill, 149 people will lose their health insurance.
Look, current health insurance.
149 million.
Million, excuse me.
So let's be clear about this. People will have access to all of their doctors, all of their nurses, their community hospitals, their rural hospitals. Doctors won't have to hire people to fill out crazy forms. They won't have to spend time on the phone arguing with insurance companies. People who have sick family members won't have to get into these battles. What this is about is making sure that we have the most efficient way possible to pay for health care for everyone in this country. Insurance companies last year sucked $23 billion in profits out of the system. How did they make that money? Every one of those $23 billion was made by an insurance company saying no to your health care coverage.
Mayor Buttigieg.
The problem, Senator Sanders, with that damn bill that you wrote and that Senator Warren backs is that it doesn't trust the American people. I trust you to choose what makes the most sense for you, not my way or the highway. Now, look, I think we do have to go far beyond tinkering with the ACA. I propose Medicare for all who want it. We take a version of Medicare, we make it available for the American people, and if we're right, as progressives, that public alternative is better, then the American people will figure that out for themselves. I trust the American people to make the right choice for them. Why don't you?
Senator Sanders, 45 seconds.
George, you talked about, was it 150 million people on private insurance? 50 million of those people lose their private insurance every year when they quit their jobs or when they go unemployed or their employer changes their insurance policy. Medicare for All is comprehensive health care, covers all basic needs, including home health care. It allows you to go to any doctor you want, which many private insurance company programs do not. So if you want comprehensive health care, freedom of choice regarding doctor or hospital, no more than $200 a year for prescription drugs, taking on the drug companies and the insurance companies. Moving to Medicare for all is the way to go.
Senator Harris, you started out co-sponsoring Senator Sanders' bill. You now say you're uncomfortable with it. Why?
I want to give credit first to Barack Obama for really bringing us this far. We would not be here if he hadn't the courage, the talent, or the will to see us this far. I want to give credit to Bernie. Take credit, Bernie. You brought us this far in Medicare for all. I support Medicare for all, I always have, but I wanted to make the plan better, which I did, which is about offering people choice, not taking that from them. So under my Medicare for all plan, people have the choice of a private plan or a public plan because that's what people want. And I agree we shouldn't take choice from people. But here's the thing. Everybody on this stage, I do believe, is well-intentioned and wants that all Americans have coverage and recognizes that right now 30 million Americans don't have coverage. But at least 5 people have talked, some repeatedly, on this subject, and not once have we talked about Donald Trump. So let's talk about the fact that Donald Trump came into office and spent almost the entire first year of his term trying to get rid of the Affordable Care Act. We all fought against it, and then the late, great John McCain, at that moment at about 2 o'clock in the morning, killed his attempt to take health care from millions of people in this country. Fast forward to today, and what is happening? Donald Trump's Department of Justice is trying to get rid of the Affordable Care Act. Donald Trump's administration is trying to get rid of the ban that we placed on denying people who have pre-existing conditions coverage. Donald Trump is trying to say that our kids up to the age of 26 can no longer be on our plans. And frankly, I think this discussion has given the American public a headache. What they want to know is that they're going to have health care and cost will not be a barrier to getting it. But let's focus on the end goal. If we don't get Donald Trump out of office, he's going to get rid of all of it.
George, 15 seconds. 15 seconds.
Let me get to Congressman O'Rourke and then go ahead, Mr. Vice
15
President.
seconds. Look, everybody says we want an option. The option I'm proposing is a Medicare for all, Medicare for choice. If you want Medicare, if you lose the job from your insurance company, from your employer, you automatically can buy into this. You don't have no pre-existing condition can stop you from buying in. You get covered, period. And if you notice, nobody's yet said how much it's going to cost the taxpayer. I hear this large savings. The president my friend from Vermont thinks that the employer is going to give you back if you negotiated his union all these years, got a cut in wages because you got insurance. They're going to give back that money to the employee?
Matter of fact, they will.
Well, let me tell you something. For a socialist, you got a lot more confidence in corporate America than I do.
Senator Sanders.
1 minute, George.
Go ahead.
All right. 2 points.
Yep.
You got to defend the fact that today, not only do we have 87 million people uninsured and underinsured, you got to defend the fact that 500,000 Americans are going bankrupt. You know why they're going bankrupt? Because they suffered a terrible disease, cancer or heart disease. Under my legislation, people will not go into financial ruin because they suffered with a diagnosis of cancer. And our program is the only one that does that.
I know a lot about cancer. Let me tell you something. It's personal to me. Let me tell you something. Every single person who is diagnosed with cancer or any other disease can automatically become part of this plan. They will not go bankrupt because of that. They will not go bankrupt because of that. They can join immediately. And we're talking 4, 6, 8, 10 years, depending on what you talk about, before we get to Medicare for all. Come on. I've been there. You've been there. You know what it's like. People need help now, hope now, and do something now.
Congressman O'Rourke.
Yeah.
Thank you. Listen, I'm grateful that we all agree about the urgency of this challenge and the fact that Donald Trump is undermining the limited protections that we have right now. But I also think we're being offered a false choice between those who propose an all-or-nothing gambit forcing tens of millions off of insurance that they like, that works for them, to force them onto Medicare, and others who want to, as the Vice President does, incrementally improve what we have, which will still leave many, maybe millions, uninsured and uncared for in a state like Texas, where the largest provider of mental health care services is the county jail system. We've got to do better. In my proposal, Medicare for America says everyone who's uninsured will be enrolled in Medicare. Everyone who's insufficiently insured, cannot afford it, can move over to Medicare. And those, like members of unions who fought for the health care plans that work for them and their families, are able to keep them. That is the best possible path forward.
Healthcare is the top issue for everyone in the country. I want to make sure everyone gets 1 minute to respond. So Secretary Castro, Andrew Yang, and then Senator Booker, you all get a minute.
Thank you. And, I also want to recognize the work that Bernie has done on this. And, of course, we owe a debt of gratitude to President Barack Obama. Of course, I also work for President Obama, Vice President Biden, and I know that the problem with your plan is that it leaves 10 million people uncovered. Now, on the last debate stage in Detroit, you said that wasn't true. When Senator Harris brought that up, there was a fact check of that, and they said that was true. I grew up with a grandmother who had type 2 diabetes, and I watched her condition get worse and worse. But that whole time, she had Medicare. I want every single American family to have a strong Medicare plan available. If they choose to hold on to strong, solid private health insurance, I believe they should be able to do that. But the difference between what I support and what you support, Vice President Biden, is that you require them to opt in. And I would not require them to opt in. They would automatically be enrolled. They wouldn't have to buy in. That's a big difference, because Barack Obama's vision was not to leave 10 million people uncovered. He wanted every single person in this country covered. My plan would do that. Your plan would not.
They do not have to buy in. They do not have to buy in.
You just said that. You just said that 2 minutes ago. You just said 2 minutes ago that they would have to buy in. You said they would have to buy in.
Have to buy in. If she qualifies for Medicaid,
are you forgetting what you said 2 minutes ago?
Are you
forgetting already what you said just 2 minutes ago? I mean, I can't believe that you said 2 minutes ago that they had to buy in, and now you're saying they don't have to buy. You're forgetting that.
I said anyone your grandmother who has no money.
We need a healthcare system.
You're automatically
enrolls people regardless of whether they choose to opt in or not. If you lose your job, for instance, his health care plan would not automatically enroll you. You would have to opt in. My health care plan would. That's a big difference. I'm fulfilling the legacy of Barack Obama, and you're not.
I'll be a surprise to him.
Andrew Yang.
This is why presidential debates are becoming unwatchable. This reminds everybody of what they cannot stand about Washington. Scoring points against each other, poking at each other, and telling each other that you're my plan, your plan. Look, we all
that's
have
called a Democratic primary election.
That's
called an election. That's an election. This is what we're here for. It's an election.
Yeah, but a house divided cannot stand. And that is not how we're going to win.
Everyone, we know we're on the same team here. We know we're on the same team. We all have a better vision for health care than our current president. And I believe we're talking about this the wrong way. As someone who has run a business, I know that our current healthcare system makes it harder to hire people, makes it harder to give them benefits and treat them as full-time employees. You instead pretend they're contractors. It's harder to change jobs. It's certainly harder to start a business. The pitch we have to make to the American people is we will get the healthcare weight off of your backs and then unleash the hopes and dreams of the American people.
Senator Booker.
Now, I am Asian, so I know a lot of doctors. And they tell me that they spend a lot of time on paperwork, avoiding being sued, and navigating the insurance bureaucracy. We have to change the incentives so instead of revenue and activity, people are focused on our health in the healthcare system. And the Cleveland Clinic, where they're paid not based upon how many procedures they prescribe, shocker, they prescribe fewer procedures, and patient health stays the same or improves. That is the pitch to the American people.
Senator Booker, close out this discussion.
Thank you very much. Look, there are a lot of people watching at home right now, listening to us, that are afraid because they are in crisis. They don't have health insurance. Their health insurance doesn't go far enough. They can't afford their prescription drugs. Look, I'm clear in what I believe. I believe in Medicare for all. I believe it's the best way to rationalize the system. But dear God, I know that every one of my colleagues on this stage is in favor of universal health coverage and comes at this with the best of intentions. And I'll tell you, there is an urgency right now in this nation. Everybody feels it. And as a person who has an ideal, I know we cannot sacrifice progress on the altar of purity. Because people in my community, they need help right now. They have high blood pressure right now. They have unaffordable insulin right now. And this must be a moment where we as Democrats can begin to show that we can not only stake and stand our ground, but find common ground.